Welcome to Disease SNS. In this video, we will be talking about 12 early signs and symptoms of HIV infection. HIV is spread through contact with an infected person's blood during intercourse, and through shared needles or syringes. The early signs and symptoms of HIV normally appears 2 to 4 weeks after exposure, and the infection is highly contagious during this period. 1. Appearance of rashes. The appearance of rashes on the skin is the first sign of HIV infection in some people. These rashes often look like a flat, or raised red patches on the skin. It may be itchy or painful and appears mostly in the chest region and the face, but can appear anywhere around the body. 2. Fever. Fever occurs when the body temperature is higher than normal. It is one of the most common symptoms of HIV infection in most people. When you have been exposed to HIV, you will experience a recurrent or a persistent fever, 2 to 4 weeks after exposure. This is because, when the virus enters your body, your immune system tries to fight and kill it off. As a result, the body temperature rises, resulting to fever. 3. Fatigue or tiredness. An unusual level of fatigue, along with other signs or symptoms, can be as a result of HIV infection. Fatigue normally occurs also as a result of the body's continual fight against the infection. When you are finding difficulties in doing simple things such as brushing of hair or getting dressed, it could be an alarming symptoms of HIV. 4. Headache. When you are experiencing an unrelenting headache, especially a few days after you had an unprotected sex, it could be as a result of acute HIV infection. The headache normally occurs as a result of reduced CD4 T cell count. CD4 T cells are a type of white blood cells that help fight infections by triggering the immune system to destroy viruses, bacteria and other germs that may cause sickness. 5. Swollen lymph nodes. When you have been exposed to HIV, you will notice a rise or an increase in size of your lymph nodes, especially in the neck region. This is because, as the body tries to fight against the infection, the lymph nodes often become inflamed or swollen. 6. Night sweats. Sweating profusely, soaking the beddings while sleeping without any exercise could be as a result of HIV infection. Night sweating can occur as a result of other health conditions like sleeping disorder. Nevertheless, it could also be as a result of HIV, especially when accompanied by other symptoms like fatigue and swollen lymph nodes. 7. Joints pains and muscle ache. Pains in the joint and the aching of muscles is one of the common symptoms of HIV infection. This is because, the virus can get into the fluid inside the joints and trigger pain reactions. 8. Diarrhea. Diarrhea is a condition of having at least 3 loose, liquid or watery bowel movements each day. Or it is a condition in which feces are discharged frequently and in a liquid form. When you contract HIV, it can affect your gastrointestinal tract, causing diarrhea. 9. Loss of appetite and weight lose. HIV can tamper with your appetite and may kill your taste buds. It is advisable to get checked if it persists for more than a week. Appetite lose can lead to an unexplainable weight loss. 10. Ulcers or sores in the mouth. If you notice a painful sore in your mouth or on your lips, it could be as a result of HIV infection. This sores can be irritating and discomforting, and they may not easily respond to treatment. 11. Nausea or vomiting. Nausea or vomiting is also one of the common symptoms of HIV infection. The virus can damage your white blood cells, reducing your immunity and making you continually have a feeling of sickness, and a great tendency to vomit. 12. Sore throat. The infection can also cause discomfort in the throat. It gives you the sensation to clear the throat often, and feels very painful. The signs and symptoms of HIV infection is similar to the symptoms of a flu, and some can also appear as a result of other health conditions. Some people might not experience any signs or symptoms when they are exposed to the infection. If you have an unprotected sex with a partner that you are not sure of his or her health status, it is important to go for a medical checkup as soon as possible, even if none of the signs or symptoms surfaces.